Well, under pressure from protests, the kind of which have not been seen in China since 1989, and with their economy beginning to falter under the corona restrictions, Beijing head sheds finally relented on their zero COVID policy on December the 7th. The result, after 2 years of extreme restrictions, has been, rather predictably, an explosion in COVID cases. But, yet again, what's a problem in China can become a problem over here. An explosion that, of course, has frightened several Western countries, including the UK, into introducing entry restrictions for the first time. Here to discuss the situation in China and the Western reaction to it is China expert and host of The Spectator's excellent Chinese Whispers podcast. It's Cindy Yu. Cindy, thank you very, very much. Now, China has spoken about essentially retaliations if we dare to restrict Chinese people from coming into the UK. What do they mean?
Well, I'm not sure there is much retaliation to be done, considering China requires inbound travellers themselves to have a negative test. So if I were to go to China, as I'm hoping to do this year, then I will have to take a test and hope for it to be negative. Otherwise, I won't be let in. So it is essentially equivalent to what they have. You can question whether or not this restriction matters in either direction, considering how endemic the pandemic already is. But at the same time, it is essentially equivalent. I guess the only thing that they could do more that other countries have done is to isolate positive cases. So there's talk of that in Italy, for example, and that would be a kind of retaliation. But other than that, as I say, negative tests are required to enter China right now.
Do you think at the moment we're hearing increasing whispers of restrictions, of mask wearing, of all of this stuff as shock horror winter comes and people get the sniffles? OK, do you think China actually provides the best example of why a full throttle zero COVID policy just doesn't work?
Well, it's really hard to say. I think under the Delta variant, where it was much less infectious and much more serious to get it, it actually did make sense. And we saw that in the first 2 years of the pandemic, where China did manage to keep cases down. You might not believe its official numbers, but what we're seeing now is that it can't hide a massive wave when a massive wave comes, because people like me, other journalists, have contacts, have family, have friends in China. So anecdotally, we know something's happening. But that didn't happen in the first 2 years. So zero COVID did work at the time. Omicron changed everything, in my opinion. This much more infectious, but ultimately more mild variant of the disease. And over the last year, we've seen various attempts to keep that under wraps, Shanghai lockdown being one of the fiercest lockdowns. And that just didn't work for this kind of variant. So, but at the same time, I'm not sure that this kind of system of opening up the timeline that we're talking about, where within a month you go from zero COVID to completely opening up, is also working either.
Now, we are seeing pictures of the Wuhan Institute of Virology there, where, in my opinion, and it is just my opinion, I think the coronavirus first started. They weren't particularly proactive in telling people exactly about it then. Cindy, I think people have a concern, don't they, that if a new variant was detected in China now, and it was more deadly, they probably wouldn't tell the world about it and might let it spread.
Sure. I mean, perhaps I would say that I'm not an epidemiologist, but in my understanding, there is an international database where tests are sequenced, and you put up your test results to this database, and international scientists can discover new variants. And you can question how many cases are being tested and put in that database, considering not many people are getting tested in China at all. But I'm not sure cover-up will be particularly easy, as I think that the Chinese government just has no idea, basically. But also, I'm a believer in living with COVID, where now in 2023 is time that we lived with this virus. So if there's a new variant, we should be looking at new ways to vaccinate people, to boost the most vulnerable. But people like me and G, we shouldn't be concerned about new variants.
No.
Otherwise, when does it end?
And I don't want to live in under any more restrictions whatsoever. I don't think anyone should have to. We've done, conceivably, everything that we possibly can do about this particular thing now. Not only have we got a vaccine, and it's freely available to anyone, and as many of them as they want, you can get jabbed up to your eyeballs if you so please. We've knackered our economy. We've ruined a load of children's education. We've created a massive mental health crisis on top of what was already a mental health crisis. People with addiction issues have had those addiction issues get a lot worse. I mean, I know alcoholics and drug addicts, for example, suffered hugely by virtue of being locked down. Several people were locked down with their domestic abusers, for goodness sake. We've absolutely brought this country, in many respects, to its knees. A lot of the time was to protect our NHS. And our NHS has to be there to serve us, in my opinion, and not the other way round. And just finally, Cindy, closer to home, on that point, any more restrictions? Do you think the British public would just resist en masse?
Yes, well, I hope so. I mean, in some ways, I feel this kind of requiring a negative test from Chinese visitors is already cutting off our nose. Because why are we putting in more restrictions at all? You know, the Chinese may require a negative test, but that doesn't mean that we should. And in order to live with COVID, we have to be okay with the idea of new variants and believing in our vaccines if that is what you chose to do. And, you know, bearing in mind that there's new variants of the flu every single year, and the flu jab gets updated with the new variants every single year to protect the most vulnerable. But other people just don't have to think about it in the same way. So I do feel like we made a political choice rather than a scientific choice by requiring negative tests for travellers from China.
I will never forget the fear. I was sat there next to my grandma. I was round at my grandma's house one day. It was just her and I, and Chris Whitty pops up, and Patrick Vallance and whoever else, and they were pumping out predictions. Now, it's all very well and good, but they were presented as fact. They could have done more. They could have done more to say that these might be way off the mark. I don't care what anyone says. I was there. I watched it live with my elderly grandmother, and we were looking at that TV screen, and it certainly was at least presented as this being more likely than not, and it terrified people, and that, I think, was wrong. Cindy, thank you very much. Cindy, you there, who is The Spectator's excellent Chinese Whispers podcast guru, and, of course, as well, has a lot of family in China, so can give us a first-hand account of what's been going on over there.